Omega-3 fatty acids are fatty substances that are required for the human body, but the body cannot synthesize them on its own. We must obtain them from foods or supplements. Omega-3 became so popular and so central because modern humans live in a state of chronic low-grade stress and chronic inflammation. This is largely driven by sedentary lifestyle, excess body fat, and high intake of ultra-processed foods. Here, omega-3 is a key player. It shifts the inflammatory balance in the body. Omega-6 has a strong anti-inflammatory action, and it can measurably reduce inflammation and inflammatory markers in the blood around 30%, especially in people with chronic low-grade inflammation related to obesity, metabolic syndrome, or other chronic conditions. And first and most important condition where omega-3 is effective is when a person has elevated triglyceride levels in the blood. It is called hypertriglyceridemia. Omega-3 can reduce triglycerides levels by around 25%, and it is recommended in major cardiovascular guidelines. Second important condition is prevention of heart disease. Omega-3 helps stabilizing atherosclerotic plaque, reduces vascular inflammation, and improve endothelial nitric oxide signaling, and it can reduce cardiac death rate around 20%. And the third condition is rheumatoid arthritis and chronic joint pain. It reduces prostaglandins and lowers leukotriene activity, and it can reduce joint pain around 20%, and it is near to non-steroidal anti-inflammatory medications effectiveness. The first condition is major depressive disorder and mood instabilities, especially EPA-dominant omega-3 formulations, because omega-3 reduces neuroinflammation, modulates serotonin and dopamine signaling, reduce depressive symptoms around 15%. And fifth important area of use of omega-3 is age-related cognitive decline, especially DHA, is structural component of neuronal membranes. It helps maintain synaptic integrity and slows neuronal membrane degeneration. And if person intakes omega-3 regularly, the risk of cognitive decline decreases around 20%. Omega-3 is effective also in children because it's important for brain development. It supports neuronal signaling, improves attention, reduces impulsivity. It has small but measurable effect. And even in healthy population, omega-3 still shows value. It leads a small reduction in triglycerides, lowers systemic inflammation, and modest improvements in endothelial function. The main dietary source of omega-3 is fish, especially fatty fish like salmon, sardines, mackerel, and trout. To reach daily effective dosage, 100 grams of fatty fish usually is sufficient, and most guidelines recommend 2 servings of fatty fish per week. There are plant-based omega-3s also, such as flaxseed, chia seed, and walnuts, and soybeans and canola oil. However, this contains omega-3 as a ALA form, and it is not directly active. Only a very small fraction is converted into active forms. Omega-3 itself, they are fat molecules. They are structural component of human cells, especially in the brain. They exist in 3 forms, ALA, DHA, and EPA. ALA is not active form. It has minor role, and it is in plants. EPA is inflammation controller, and it reduces inflammation and protects blood vessels and reduces triglycerides level. And DHA is structural molecule. It builds brain and retina and stabilizes neuronal membranes. If you want to intake omega-3 as a supplement for general health, 1000 milligram per day is optimal. It should be a combination of DHA and EPA, and doses below 300 is ineffective usually. For high triglycerides or systemic inflammation or chronic joint pain, usually 2000 milligrams per day is used, or even higher, up to 4000 milligrams, combination of DHA and EPA. For mood and stress and emotional regulation, usually 1000 milligrams is enough. Best timing to intake is with meal, because omega-3 is fat soluble, it's fat itself. That's why if you intake with meal, absorption of omega-3 is increased around 30 to 50%. The minimal effective duration should be at least 8 weeks. That's why it requires time. And optimal intake is around 6 months. Even longer intake, 4 years, is possible and effective and well known and described. Usually it's safe. Only minimal problem with omega-3, there is a risk of bleeding, but very minimal, especially if people is on blood thinners like aspirin or warfarin or anticoagulants. But this risk is minimal. Usually doses should be high, more than 1000 milligrams, and a person should have high risk of bleeding. In normal population and dosage under 1000 milligram per day, usually omega-3 is very safe and it does not increase risk of bleeding any importantly.